I'd like to welcome Hannah Salpietro and Holly Johansen to the Wellness Nurse podcast. Holly and Hannah are exercise physiologists at the Joint Nunda, which is a leading physiotherapy and allied health business based on the north side of Brisbane. The team supports a variety of clients along their healthcare journey. So we often think of going to see a health professional when there's a problem. What's your take on stepping in before problems develop, and how important is exercise in wellness?
Do you want to go first or do you want me?
You go.
Okay. I think there's never a wrong time to come and see an exercise physiologist, because we help people through the whole journey with kind of exercise, movement and health. So all the way from healthy, well populations, so people who are maybe just looking for support to get started with exercise, all the way down to people with disability, chronic disease, mental illness. So I don't think there's ever a wrong time for people to come and see us. And we see a lot of people who are both at the start of their health journey and then quite deeply in it as well. Yeah.
For those of us who may not know what an exercise physiologist is and how they differ to a physiotherapist, can you walk us through your role as a member of the healthcare team?
Yeah, absolutely. So EPs, we have a more of a role with chronic disease management as opposed to acute management. However, we do a bit of both. So a physio will typically specialise with acute management. So, for example, you roll your ankle, go see a physio, things like that.
Yeah.
Whereas EP, we'd specialise more so in we're rehabilitating from a stroke or something that's a bit more chronic. So I've got type 2 diabetes. You'd probably go see an exercise physiologist over a physiotherapist. Physios do have skills to be able to do that, but they specialise a little bit more in the acute rehab sort of stuff.
Right.
Yeah.
Okay.
And I think the biggest difference, EP and physio, is the fact that physios have the ability to diagnose an injury, and they can also use like hands-on manual therapy techniques, but we don't diagnose, we don't generally use hands-on techniques, but we both use exercise and movement as a tool to manage both like acute injuries, but then also physios can also help in the chronic space. But that's kind of our jam, is chronic disease, chronic disability, chronic injury, mental illness, all of that stuff.
Hannah, could you share how your philosophy of using movement as therapy helps in promoting mental health and overall well-being?
Yeah, so mental health and mental illness are my kind of favourite area to work in.
Right.
And I think of exercise as being, and movement as being part of like a tool in your toolbox of managing your physical and mental health. So exercise doesn't work if it is the only tool in our toolkit. It needs to be alongside things like good nutrition, good sleep hygiene, medication management, other allied health professionals or doctors, specialists, etc. So I don't like to encourage exercise to be the only tool. I think it needs to be accompanied by a holistic approach to health and wellness.
Yeah, for sure. And Holly, how does your approach of using exercise as treatment support individuals with chronic conditions, and what impact have you seen it have on patients?
Yeah, well, with chronic disease, typically when you're diagnosed, it has a significant effect on your life, so both psychologically and physically, trying to manage that. Having an EP just to be a guiding hand and kind of go, okay, this is what we can do, is really beneficial.
So it's giving them hope. This is not focusing on what you can no longer do, but it's stepping into, well, let's focus on what you can do and keep that going.
Improving people's capacity, their function, without kind of making it all about exercise. It's more so about movement, what we can do.
Yeah, which I think is what we do so well as exercise physiologists, is look at every kind of aspect of their life and how we can use movement and exercise so they can better participate in their like meaningful activities. It's kind of all
Right.
about how can we help people improve their quality of life, and how can we use exercise so that they can keep doing all of the things that they love. Because when
Yeah.
someone's diagnosed with a chronic disease or a disability or an injury, it takes away so much
Mm.
from them. So we're like, how can we use movement to give back what they've lost or find alternate routes?
Yes, so
like Holly did
different ways of achieving
Yeah.
the same outcome, is it? Or what?
Yeah, like you should talk about one of your clients who you helped get back to volunteering.
One of this specific case, I won't go into too much detail, but had stopped work, and work was a very meaningful part of their
Right.
life, being part and contributing to a community. When he'd come in to see me, he was kind of a little bit down in the dumps about like, okay, like I can't work, trying to find something meaningful. So we managed to find something that he can do, which is volunteering at a nursery. So he was interested in being outside as opposed to in an office. And he has a good social network there now as well. So he goes there once a week, and it's really adapted for his disability as well. So, for example, like he can do it sitting, standing. They're very, very flexible. So it was very good to find a little, like something for him to be able to do.
It's actually life-changing for him because that chronic disease prevents him from doing, and I don't know what his particular condition was, but it prevents him from doing the meaningful activities, and you find ways of adapting that, and he can engage again. That's huge impact on his mental health.
Yeah, absolutely. And we were even, when he'd come in to see me, he was sort of struggling with finding appropriate exercise as well. So we'd managed to find, okay, we can do resistance training to help with this. And we've also recently got him into swimming too, which he is loving. So he's doing, since he started seeing me, he's doing all these different things now. So he's like swimming, volunteering, and then doing resistance training, and then he's volunteering down the bookshop too. So
bless!
Always doing
That's
stuff
incredible.
and just engaging in the community a lot more, which has been awesome for his mental health.
And can I ask, was swimming a brand new activity for him?
Yes.
And how old would this client roughly
I
be?
think he's in his mid-60s.
Okay.
Yeah.
It's just beautiful to hear that story. I think
It is.
a lot of people, as we get older, we don't want to try new activities. It's hard being a beginner.
Oh, it
And
is.
I think when you can introduce clients to something new and facilitate that path for them, it just gets them started, and it's amazing. Yeah, well done.
Thank you.
Yeah.
Holly, could you tell us more about the women's strength class and how it's tailored to meet the needs of women at different stages of life?
Yeah, so the women's strength class was kind of born out of an idea of we want to make a space that's welcoming, safe for beginners to try new types of training, so resistance exercise. And it was sort of targeted at that age bracket that typically is at most risk for chronic disease, osteoporosis, things like that. So osteoporosis prevention and management was the main goal of the class.
Right.
Plus, we wanted to go, okay, how can we keep these ladies adhered to exercise that is new? So the community aspect became really important in that sort of part of the women's strength. So like I mentioned, with it being for osteoporosis, so in about that 40 to 65 categories where we see most of the ladies fall, and within that you have a really wide range of abilities as well. So you have beginners, you have people who have musculoskeletal conditions, all these other things as well. So we make every exercise adaptable to where you are at the moment. So whether we're making it lighter, making it harder, whatever challenge you're after, we can tailor it to you.
That's really great.
Yeah.
It's a really individual approach, a group setting.
Yeah.
So you've got that community and you can build the friendships there.
Yeah.
So
But
nice.
it's an individual approach for the exercise itself.
We really try to keep the group sizes small as well, so it is still personable. And like as well, another barrier to these ladies potentially going to a commercial gym is, oh, I'm going to get lost in the crowd, and kind of keep to themselves a bit. So we really encourage like conversation throughout the class amongst everyone. So a lot of the ladies have similar things going on in their lives. So either they're like becoming parents, or some don't have children at all, and which is actually a large percentage of the ladies as well. And they chat all about that and what they're up to. They go get coffee after. Oh, it's so cute.
It's so beautiful. And I think I really like how you've organised it in the space that we have. Like, each station has got pictures of exercises, and it's got the options to make things harder and easier. So there is kind of a structure, but a lot of flexibility and autonomy within that structure, which I think is what is really different to going to a commercial gym, where you feel like there is no option but to follow exactly what the trainer is doing, and it's not tailored to your own needs.
Oh, that sounds so great.
It's awesome.
Really great.
They're so cute as
I
well.
know.
They go and like get coffee after, and a lot of them are local as well. So there's two that like walk here together from. They live on the same street, so they walk together. It's so cute.
It's so nice. And even like us, well, maybe it's just me, but even whenever I'm in there, because I don't run the women's strength classes, I feel like I even have a connection with all the patients that are in there, because it's just such a nice community, social feel down in the movement zone. I think that's what makes a big difference. Yeah.
I think you've both highlighted something that's really important. So the two women that are walking here together, they didn't have that beforehand. Like, exercise doesn't have to be something with a negative connotation. I think I'm really learning that even structured exercise can just be such a social part of people's lives.
Yeah.
And no doubt, even as the programs finish here, I'm sure those women will maintain contact and continue that friendship. So it's multifaceted, isn't it, when we engage.
It is really tailored to, like, some people really want to come in the door and work out and leave, and that's fine. You can absolutely do that. But there are some ladies as well who don't really care for the exercise, but they're like, oh, that's like my one time I get out of the house in the day, and I come and I talk to people I wouldn't normally talk to.
Yeah, so it can be both, and we're all different. So yes, that option is available. If you just want to come in and do the exercise and go home too, there's no pressure. I noticed this business, The Joint, also offers online assessments, which I find really interesting, and I've seen more of that as I've researched. So this is great, as it means that people anywhere across Australia can access support. And it's also worth noting for the listeners that bulk billing for some services is available, and there are rebates for NDIS clients. So often, with the cost of living so high at the moment, we forfeit looking after our health. So it's worth exploring what your local healthcare businesses may have available in terms of cost savings.
Yeah, and Holly's recently put a lot of time aside putting together what are they called, the EP packages, training packs, because we found there was a gap kind of in our services that we were offering, where we'd see people maybe on a chronic disease management plan. That plan ends, but because of the cost of living, they can't afford ongoing care as regularly as maybe what they need or want, or they're not suitable to go into a class. They want to have or need one-on-one kind of sessions. So Holly's put together with the rest of the team like a training pack that you can probably go into more details about.
Accessible over the long term. So it's kind of comparable to like a PT service, but us being exercise physiologists, for those who don't want to go to a PT or are concerned about their specific health needs, seeing an EP might be more appropriate, and we wanted to make that more accessible, more affordable for people to be able to do that. So we've come up with a plan to a direct debit service actually, or upfront payment, where you get a discounted rate on your EP sessions to be able to do it for longer term. Yeah.
That
Yeah.
sounds like a fantastic
Yeah.
initiative. Well done.
Yeah. It's awesome.
Yeah, it's going well so far. Good.
What are some of the biggest challenges you face in your work, and what are the most rewarding outcomes you've witnessed?
Go ahead. She's been talking about this one.
One of my biggest challenges is because I work from a weight inclusive, non-diet approach to health. Biggest challenge I face is how weight centric the health system is and how it can stop people getting access to the right treatment. They end up feeling stigmatized and have such a negative experience with exercise, but also the other treatments that they're getting. And I'm trying to fight the good fight to move the focus away from weight, body shape. And that's probably the biggest challenge. Is the other pressures I face from people who are maybe not at that part of the journey yet. So other health professionals who are maybe still quite weight centric. That's probably my biggest challenge. Yeah, it's hard.
Yes, that end I find, well, also that when people come in and they are weight centric, but I find it challenging as well when like trying to get the word out of what EP is, because it is a fairly new health profession. Most people will know what a physio does, but now we're trying to push and kind of go, okay, well, this is what an EP does. This can also be in your health care team as well. So trying to get out the word of what we do.
Yeah.
We're getting there.
I'm really interested in the term weight centric that you've used.
Yeah.
I guess for me, I'm researching the implications that are clearly associated with weight and how by reducing body weight to a healthy weight, we can reduce the risk of developing some chronic diseases such as cardiovascular disease, some cancers, stroke, even some dementias. So can I ask for your help in how we talk about weight? Because it is a health issue for me. Weight's not an aesthetic issue, right? It's not so much what we see, it's the health implications behind the weight. So as I'm navigating this journey, I want to know from your perspective, what is a good way to navigate that? Because as a nurse, I need to be able to talk about weight.
Yeah. I'm not an expert. I'm still learning, but I think the way that the health system has been in that it focuses solely on weight being kind of the primary determinant of health is it can stop people accessing the healthcare that they need. So surgeries have weight limitations, and often when I've talked to people, like I went to an event the other week of people with fibromyalgia and chronic fatigue, and one of the people presenting said, how many of you have been told you should just lose weight and your health will improve? And almost everyone in the room put their hand up. So I think often that's the first thing that people go to try and change. But we actually, when we look at all of the factors that influence our body shape and size, we actually don't have a lot of control over a large number of factors. So the genetic predisposition, the age we're at, all of those kind of like biological and physiological impacts. But then we also see people who are on, like I work at a mental health hospital, they get put on antipsychotic medication and their hunger cues completely change, their weight balloons, but they're then told by their psychiatrist that they need to lose weight when it's kind of a losing battle.
I see, but the cycle is the medication has a side effect of an increased appetite. I see,
And so I guess I try to do is take the focus off weight, because there's so many other ways that we can measure health, because we can't just look at someone who's in a bigger body and assume that they're unhealthy. There's like quite a number of different studies. I don't know if you've heard of the fitness versus fatness study.
No, tell me about
that's
that.
a really good. So it used the BMI and got groups of people who were in the overweight and obese category, and then got people who are in the normal weight category. Those groups, they had people who were physically active and fit, and they had people who weren't, so they were fit and unfit, and they basically compared like the risk of dying from being at that weight and at that cardiovascular fitness, and they found the people who were underweight and unfit had the same risk of dying as people who were in a bigger body and were unfit as well. So cardiovascular fitness is actually a better indicator of how healthy we are.
That's it.
Yeah.
I think it's so important to acknowledge that we are all different shapes and sizes, and it's those things, it's the habits and the activities that we incorporate that determine longevity.
And I think people have a hard time accessing healthcare anyway, and especially people who are in bigger bodies. You know, think of how many times they would have been told you should just lose weight. Like, it's to be healthier. It's not that easy. We don't want to.
If it was that easy, we'd all be doing
we'd
it
all look the
overnight.
same.
Yeah.
And I just think I don't want to be that person who puts another barrier up for them to access safe and effective treatment, because they've probably just come up against that so many times and been stigmatized, and it just stops them even wanting to participate in healthy behaviors, because every time you've done it, it's not worked.
I see.
Yeah.
Hannah, I'm sure that just must be such a refreshing approach for people who come here and are welcomed by that approach, by yourselves.
Yeah.
Yeah.
We just got a blind put in the movement zone to cover one of the mirrors so that people don't have to look at themselves when they exercise.
What a simple thing to do.
Yeah.
But that's very confronting.
Yeah.
Having a mirror right there in front of you, and even more so when you're exercising, and
it's a challenging topic, and I'm still learning all the time. So, and it's kind of a new space, I guess, for people in healthcare to even everything we learnt at uni was weight loss, and then you come out and you actually work with people and you realise it's not that simple.
It isn't. It's certainly not black and white, and it's not simple. Looking ahead, how do you see your approaches evolving, and what new initiatives or ideas are you excited to explore in the future? You go.
I've been mostly interested in like neuro sort of cases, so that's kind of and cancer management as well. So that's kind of an area that I'd like to evolve in, and also honing my skills and being able to implement all the things that Hannah's just spoken about. So being inclusive and things like that, not putting up barriers for people to access care, and finding ways that we can do that with those populations. So that's what I'm interested.
Wanting to extend my skills in like the eating disorder or disordered eating space with exercise, but then also maybe moving away from just being an exercise physiologist and being able to utilize like other skills to help people in all other aspects of their life. So maybe I've done like acceptance and commitment therapy training, so being able to use those skills to help people live a life they want to live. And I just think we're both very passionate about, I don't know, making our service very inclusive and helping people, like we've already talked about, you know, it's not just about exercise and getting stronger, it's about what they can do to help themselves like fully be present and show up in their life in meaningful ways. Yeah.
I love that. It just seems like you both have such a holistic approach. Like your initial example, Holly, of the fellow who's now volunteering in the nursery and all the other things that he's doing. It is a holistic approach, and it's beautiful to see. And I think just, so many people, I can see so many people benefiting from the services really of EPs. Yeah. And it's thrown quite a light on what you do. And I love that. So thank you both so much.
Thanks for
Thanks
having us on to talk.
Yeah.
Talk about EP. Yeah.
All right. Well, thank you again.
Thank you.